Hi, I'm Karma Matti-Jackson, CEO of Matti Consulting. Thank you for joining me today for this segment of a four-part series entitled A Critical Hour for Long-Term Care. You know, chances are that all of us have heard something in the headlines recently about skilled nursing facilities, assisted living, COVID-19 and long-term care, or maybe something to do with staffing shortages in long-term care. The purpose of these briefings is to provide some data to sort of wrap around those headlines and to give us all some additional information to consider as we make our opinions and decisions about long-term care. Today's presentation is a data-driven review on skilled nursing facility Medicaid rates. As an analyst, I spend a lot of time digging down into data to see what it can tell us about our past, about how we got where we are today, and more importantly, how we might use this information to guide us in the future. And for that reason, I've included independent data analysis from several sources, including some of my own. Today's story is about employers, some of which are fairly large, that are struggling to make payroll. And these employers happen to be providing care to some of our highest risk, most vulnerable elderly individuals. So we're going to take a look today largely at financial information, but I don't want to give the impression that it's all about money, because it's not. There are other things going on, and I would encourage you to take a listen at the other parts of this series for more information. Washington State has 206 licensed skilled nursing facilities, and about 95% of those are providing care to individuals on Medicaid insurance. They're employers to over 21,000 of our state citizens, and in some communities, they're fairly significant employers. And these numbers do not count the individuals that are earning wages through contracts with skilled nursing facilities. Many times they have contracted individuals coming in to perform repairs on the building or maintenance, nursing staff that come in through contracts, as well as things like sometimes laundry services. So pretty significant employers. Of the employees working at skilled nursing facilities, 63% are nursing staff. And one of the things that often gets overlooked is that this is one of the highest diverse workforces for nurses in our state. 41% of the nurses working in skilled nursing facilities are non-white, 27% are foreign-born. So we have about 15,000 individuals being served in skilled nursing facilities on any given day, about 8,500 of which are individuals on that are low income and on Medicaid insurance. The numbers we see today are not traditionally the numbers that we've seen in the past. And if we go back as far as 1995, 45% of the Medicaid individuals that were being served in long-term care were being served in skilled nursing facilities. But the state has made some very concerted efforts over the years to provide places for individuals to be in community and in home. And we've seen this 4% annual decline in the number of cases that are going into skilled nursing facilities for Medicaid. However, we're starting to see that accelerate. And in the past year, we've seen that drop to about 8%. And with all of the activities of late around COVID-19 and restrictions on skilled nursing facilities, admissions, as well as visitations and things like that, understandably, we've seen a huge drop in the number of individuals being served in skilled nursing facilities. Now, the Washington State Caseload Forecast Council is projecting that this drop will flatline and then will begin to increase again. And the reason that they're doing that is because we have such a large population that's going to be aging into long-term care over the next 4, 5, 6 years. And so the policy conversation or the discussions that need to be had at the state level or with policymakers is, can we serve all the individuals aging into long-term care in dispersed settings, or do we need some congregate settings? And if we do need congregate settings, what is the role of skilled nursing facilities in that system of care? So what does that incoming population into long-term care look like? Well, we know that today the average age of an individual in skilled nursing facilities are age 79. And so what I've done here was I took a look at the Office of Financial Management's population forecast for ages 79 and older. And what I learned is that over the next 4 years, this population will grow by 30%, and over the next 10 years, it'll grow by 73%. And while we're not talking about staffing shortages or the shortages of nurses in our system in this presentation, I do think it's important to bring this up as something that we need to consider as a state. How are we going to serve the quantity of individuals aging into our system in the face of the nursing shortages that we're dealing with? So I would encourage you to go ahead and take a look at the other parts of this series. In addition, we know that 57% of individuals in skilled nursing facilities today are female women. And this is important because I was taking a look at profiles of older Americans, which is a study put out by the U.S. Health and Human Services. And what I learned is that women who are 75 and older are much more likely, twice as likely as men, to be living alone. And what's most concerning about this is they're also highly more likely to be poor. In fact, nearly 20% of all women living alone beyond the age of 75 are poor, and this disproportionately impacts African American women. And finally, we know that we have a diverse group that it will be aging into care, and so we need to be considering and talking about how we are going to deliver culturally competent care. So one of the misperceptions I think that has come out particularly lately in the face of headlines around skilled nursing facilities is this idea that, or this notion that skilled nursing facilities are unregulated. And this is just highly untrue. In fact, it's one of the higher regulated healthcare sectors. Skilled nursing facilities are required to do very, very detailed cost reporting if they take any Medicaid or Medicare residents. If they take both, they are required to do 2 reports. And there are at least 40 quality measures the last time I counted, many of which are tying payments to performance. For the quality measures that are not necessarily tied to payments, they're tied to this 5-star rating system that any citizen, you or I, can go to, and we can take a look at how the facility is rated. And it does impact the facility's bottom line, because if they have a poor rating, individuals can choose not to go there. So now we're going to move a little bit more into the financial picture of things. When looking at Medicare cost reports for 2019, we see that skilled nursing facilities in Washington State have the 3rd highest cost of care in the nation. In addition, the staffing costs, the cost for wages and labor, are 5th highest in the nation. And this is true both for nursing costs as well as overall wages. So on the last 2 slides, we were looking at Medicare costs and reported information, dealing with all payer types. And so now we're going to drill down a little bit more into what's going on with Medicaid. And what we see on this slide is some analysis that was performed by Department of Social and Health Services, where they took a look at what is allowed in Medicaid costs. So the amount of costs that individuals are incurring for serving Medicaid compared to what's being paid out in Medicaid payments. And what we see is that in the last 5 years, we've seen this sort of growing gap between Medicaid costs and Medicaid payments. And most recently, DSHS has reported that the shortfall in 2019 was $117 million. We've continued this analysis forward in the next couple of years, and what we see here is that the shortfall is slightly less, and that is due to the one-time rebase and inflation that was provided by the 2020 legislature. So taking a little bit of a deeper dive into the Medicaid shortfalls, Using the DSHS analysis, we see that 90% of skilled nursing facilities suffered a shortfall in their Medicaid payments in 2019, and the average amount was about $667,000 for that year. In addition, 13% of all the facilities suffered a shortfall of $1 million or greater. So that's 182 buildings out of 206. So when we look at the projections for Medicaid over the next year, we see that the number of buildings suffering shortfalls declines to 158, which is about 81% of the buildings in our state. And that is largely due to the infusion of funding from the 2020 legislature for a one-time rebase in annual inflation. In addition, though, it is due to the COVID-19 relief funds that are being distributed. The federal government provided an enhanced match rate, which is then being turned into this Medicaid rate add-on to help providers with the increased costs for COVID. This funding is slated to go away eventually, and when it does, we do expect these shortfalls to increase. So why all this conversation about funding and shortfalls and money? Well, the bottom line is that providers are in an unsustainable situation at this point. And while I'll be the first to say that building closures are not only about money, there are certainly other factors in play. We can't ignore the relevance that Medicaid has in this situation. So since 2017, we've seen 25 buildings close, and I think what gets lost in this conversation is the impacts to the community. It is a huge disruption when buildings close, and so what we've done here is look at the 25 facilities that have closed, and we know that at least 1,733 jobs were lost in a community, and 1,300 residents were displaced. So all of this just leads us to the question, what is going on? For many of us, it might feel like the government is constantly throwing money at skilled nursing facilities, but they're always behind. So why are they always behind? And what I can tell you it's not the executives taking the corporate card and flying to the Bahamas or other reckless, irresponsible spending. What I do know, though, is I know from looking at data that Washington has some pretty progressive policies. And while these are fantastic for our labor system, we are living in a state where having living wages is important, it comes at a cost. And so what we see is that we are the highest minimum wage in the nation, 50% higher than the rest of the nation. We are one of only 8 states that are requiring employers to contribute to family leave. We are one of 15 states that have employer paid sick leave. And Washington has a very competitive labor system. According to the Bureau of Labor Statistics, 20% of all waged and salaried workers in Washington state are represented. Third highest in the nation for having the most represented employees. And while this is great for making sure that people are getting a living wage, it also translates into a very competitive labor force. And we can't leave out the fact that Washington state is 4th highest in the nation in terms of sales, service, and fuel taxes. And while these are wonderful for funding government services and providing a good infrastructure and keeping our roads good, they come at a high cost to operators who are delivering services. So all of this translates into higher costs for doing the business that we do here in Washington state. So we know that there are many things that contribute to the viability of a skilled nursing facility, but looking at the data, it seems pretty clear to me that Medicaid is a contributing factor. We know that Medicaid rates are not keeping pace with Washington's progressive policies and the cost growth that happens thereof. We know that about 63% of all resident days are paid for with Medicaid insurance. And at one time, providers had some flexibility to use revenue from other sources to cover costs when Medicaid did not pay for the cost of care for a Medicaid resident. However, we are seeing those revenues decline as well, particularly for Medicare. So the flexibility to use other revenue sources to pay for Medicaid is just not there anymore. And so what we're running into is facilities that are running on chronic financial deficits. And this information is coming to us through the 2019 Medicare cost report, where we see 74% of Washington's skilled nursing facilities are operating on negative operating margins. And, you know, the average negative operating margin loss is 2.7%, which ranks us third lowest in the nation for operating margins. In addition, we know that the days of cash on hand is about 14 days. So if we want to maintain skilled nursing facilities in our system, and if we believe that this type of care has value to help address the long-term care populations coming forward, then it's clear that we do need to make some decisions around what to do with Medicaid. And the recommendations that you have before you on the screen are put forward by the industry as recommendations that will help the situation and help to maintain skilled nursing facilities. And what they're saying is just a continuation of what the 2020 legislature did, continue to provide the annual rebase with an inflationary adjustment and support the DSHS proposal for that, as well as increasing a fixed rate for direct care from 100% of the median to 105% of the median. So in closing, we know that funding for skilled nursing facility Medicaid rates, it helps to reinforce a highly diverse workforce. And it also helps to make sure that skilled nursing facilities can compete for the nursing staff that the residents need, but also that the legislature has mandated. In addition, it allows facilities to maintain and provide quality care to the highest risk, most vulnerable elderly citizens in our state. If you have any questions or would like more information about the data or technical material in this presentation, please feel free to reach out to me. If you would like information about advocacy or the policy recommendations included in this presentation, please contact Washington Healthcare Association and/or Leading Age Washington. All of the resources that were used to build the data analysis in this presentation are available to you upon downloading this slide deck. Thank you.